I could say I'm a health entrepreneur. I previously worked in the health sector, although I've never worked for government. I'm mainly private sector person.
Right.
So starting out, I worked with the Case Medical Center in town. I was there for almost 18 years, but I did stints abroad as a contractor. You could say, what do you call these people who go out and on their own and venture out and do stuff? So I ventured into Ebola management in Liberia and Sierra Leone, where I was working in the treatment centers. I think I was there for close to half a year. I worked in South Sudan, still for like 2 years as a private contractor. This necessitated dealing with deadly diseases, working in difficult conditions. But also an advantage I got there was training. They train you how to work in difficult conditions, working in multicultural environment, working with difficult people, difficult government officials, and everything around you difficult. Issues of security in difficult countries. So that helped me a lot with trying to appreciate the world, the side which is not very good. Okay? But also while there, it also gives you a lot of time, because when you work internationally, apart from working in difficult conditions, you're also given a lot of time to always rest. Now, during those times of rest, I came up with an idea of really venturing into business and trying to maybe change my life, but also change the life of communities. So my first venture really was a medical center. I thought I would start a medical center to help mainly old people and maybe try to handle the issue of non-communicable diseases. So while there, the income I got from there, I bought land and built a medical center, a 30-bed hospital from that income. So which I really started building like in 2013, but by 2016 it was open. And then I came back because I'm like, since I've built a medical center, I don't have to move all over the world handling other people's issues. Went back home, I could actually turn this around, make an old people's home and, turn it around. So we came, but patients were very few, patients are very poor. So we started slowly. We'd receive one patient a day, almost one patient a week, then 2, then 3. So the center started growing, and by 2019, which is 3 years later, still we hadn't really taken off. So most of the center's income would be from my own pocket to try and pay staff, buy drugs, things like that. Also, we had a model which is still running, where if you are an old person, we actually examine you and give you the medicine for free. So we formed a foundation and tried to fundraise for it. That foundation still runs. So if you're an old person, you can actually come to the center and get treatment for free. Of course, highly specialized care may not be free, but basic medication for diabetes, hypertension, we give for free. For those who can afford, they pay 10,000 and they get the drugs. And that number of patients has grown. But also what is important, that it gives me satisfaction to see that all people who have retired and have no source of income can still treat their diabetes and blood pressure with just 10,000, and they identify with the center. So this was a model where there was business, but also there was charity in between there. But during COVID-19, 2019, when COVID was here, by 2020 January, we had a lockdown. So all these old people could not move to come and pick their drugs. Also patients couldn't move. But also the adventurous person that I am, during COVID-19, I was involved a lot in reading around it, and also, you could say, a private COVID response. So during COVID-19, much as I've been borrowing and running that center, during COVID-19 I was able to turn around the center and create a space where we treated a lot of COVID-19 patients. And somehow during COVID-19, we got a little bit of income and were able to turn around the business part of the center. And we got enough money to pay for everything that was used to build the center and also prepare ourselves for the future. You could almost say we moved 10 to 20 years ahead of us during a very short period of time. So, and it is then that from my training, I appreciated that even if you have a successful business, especially for a short time like that, you should ideally diversify. That's when I decided to go into the pharmacy business. Most importantly, I knew the business because I have training as a medical person. So I opened my first pharmacy in Naguru, and later these have grown to 4 pharmacies in the past 5 years. Of course, it's a different kind of business because in the health center, the doctor drives the business. He advises the patient on which medication to take, which tests to do. In a pharmacy, in many cases, living prescriptions, the patient tells you what they want. And then you need either a sales a skill set to be able to convince them maybe to take something else. But on average, the customer is the one driving the business. In the medical center, it's the staff driving the business. So there are 2 different models. But the advantage is that they complement each other, that I'm able to move drugs to the center to help patients, okay, when there are deficiencies there, and vice versa. And of course, the other advantage of pharmacies is that it puts you more in the business field more. You have to balance books every day, this and that. So that's how we've moved. We've been able to expand, and we've been able to get training from TBN, which has also helped us to appreciate things like cost of goods, profit, bookkeeping, projection, BCP, a lot of things. The name of the facility is Sanctuary Medical Center. As I was out there working, I told you get a lot of time to actually rest and reflect. So on reflection, I appreciated that you can actually make a difference in society. My original idea was actually to create a free medical center and keep fundraising for the medical center, but give things out for free, because you appreciate that there are so many people who have and are willing to give, and also there are so many people who don't have and would love to tap into this. And you see, this is not like food where you'll get greedy people coming to take food, but this is medicine, and for particular reasons. So the people who need it actually need it. So that motivated me really to make a difference. But making a difference also eventually brought in a business perspective, and you could say an awakening to appreciate that entrepreneurship and business actually can make a difference. So we continue with our dream that we continue to give out free medication, but also we've ventured into business to look at things differently. When you're starting out, I appreciated that starting a business in a place where I rent would break my back. So from the word go, I appreciated that I can't start a medical center in a place where I'm renting. Although now I have almost 5 locations of pharmacies and other things which I rent, but I didn't start out renting. And that helped me to overcome that challenge and resilience. When we started the center, we actually gave the business a 10-year outlook. So we didn't make any money for almost 4 years. I supported the business. But when the business broke even, it was able to open up other ventures. So for me, the issue of rent is always, it's a fixed cost and it's always a pain. Currently, I pay out a lot of money in rent. It is, of course, now I have to plan for it, but I think it's a big challenge. But how I looked at it initially was looking at the long-term vision and on the onset, handling the problem even before I venture into it. Mainly TBN has helped us to appreciate the life cycle of business, especially things like procurement, bookkeeping, projections, costs of goods, losses, profit. So we are now able, and unlike what we used to do before, we take 3 months to do stock take. Now we are able to do it on the computer, and also we do it monthly. We are able to project what we use on a monthly basis. We are able to handle procurement better. We are able to appreciate whether we've made a loss or a profit before we just keep selling and collecting money. Also, we never used to bank, which now we do. Also, we never used to budget, which now we do. So on average, I can be able to share the health of the business at any one moment, which I was not able to do accurately before. Record keeping made a big difference for me. Because with record keeping now, for example, if anyone comes to see me and ask me about the business, I'm able to accurately show them what's going on. Myself, I'm able to compare the past with the present, and then I'm able to make projections. I'm able to plan. So the issue of record keeping for me was so important. It helps you to know a lot about the business, to know who you are. That if last year you had a lot of drugs expire in this portfolio, this year you know how to manage. For example, in pharmacies there is a model which says that maybe you need to stock so much of the fast moving goods. And then if even the fast moving goods expire, then what should you do? You change. Because you've been having your records are able to communicate to you. So the issue of record keeping for me made a huge difference. Although the modules were so many that you could really appreciate that every module is very important and hitting its own area. It is very clear. I want Farak Pharmacy to be in each and every corner in Kampala. It's as simple as that. But now we have 4 branches, which we've opened in the past 4 years. So we hope that in 10 years, we shall have 14 branches. That's a branch per year. That's where we see ourselves. We don't employ a lot of people, especially in the pharmacy. We employ on average 2 people during the week and 2 people over the weekend. So when we joined, I think we had 4 people, and now those have grown. Now we have on average more than 10, I think. But of course, when you add other people who are working in other areas in the hospital, that number of staff grows more than 20. The issue of BCP, which is business continuity planning, is something that TBN should focus on when they are training entrepreneurs. We live in a world where nowadays tomorrow is not assured. All catastrophe is always a day away. So how people are able to ensure that their businesses survive tomorrow, a very difficult one, but it's something which should be on everyone's mind. That today the US government has withdrawn funding and disrupted everything. The other day it was COVID-19. Tomorrow it's an earthquake. So this constant change of the business landscape is something which everyone needs to always anticipate and prepare for.